understanding the different types of back surgeries. Have you heard of spine fusion, laminectomy, disc replacement? If your doctor has mentioned spine surgery and you're feeling overwhelmed, you're not alone. In this video, I'll break down the most common types of back surgery specifically, what they're used for, and what to expect, so you can make sense of your options. Hi, I'm Dr. Deeptee Jain, and I'm a board-certified orthopedic spine surgeon who's guided thousands of patients through both non-surgical and surgical solutions. If you're trying to understand the surgical landscape or considering a procedure, this channel is here to help. So hit subscribe, and let's make this process less intimidating. Back surgery is usually considered after non-surgical treatments like physical therapy, medications, and injections haven't helped substantially with the pain. It's an option when there's pressure on the nerves, instability or abnormal motion in the spine, or structural damage that's limiting your movement or causing severe pain. So let's go over some of the different kinds of spine surgery. So this is a model of the spine. So I'm going to start out by talking about laminectomy. A laminectomy removes part of the vertebra called the lamina. That's the back portion, this portion here of the spinal bone. It's often done to relieve pressure on the nerves from spinal stenosis. Think about it like clearing space in a tight hallway so that your nerves can move freely again. Next, discectomy. The discs of the spine are located here, and a disc can herniate and it can put pressure on the nerves. So a discectomy is used when the herniated disc is pressing on the nerve, causing pain, numbness, or maybe even weakness. And the surgeon will remove oftentimes part of the bone, depending on exactly where the disc herniation is, move the nerves out of the way and pluck out that disc herniation to take the pressure off the nerve. It's one of the most common spine procedures, and when done correctly, the relief is pretty reliable. Next, spine fusion. Spine fusion joins two or more of the vertebrae together, eliminating motion in between them. It's usually used for instances in which patients have spinal instability or abnormal motion that can contribute to the spine. It's often also used in patients who have spinal deformity or an abnormal structural alignment to the spine, or if patients have severe degeneration. While it does indeed limit motion at that level, it does often reduce pain by getting rid of that excess or abnormal motion that shouldn't be there. There are lots and lots of ways to do a spine fusion. It typically involves screws and rods that are often placed in the back of the spine, but there are also other ways to perform a spine fusion that can involve putting in a cage in the front of the spine. Artificial disc replacement. In some cases, some surgeons will use an artificial disc replacement instead of doing a fusion. This keeps some motion at the spine. However, it's important to remember that an artificial disc is never going to fully exactly recreate the motion of your spine, especially in the neck or the lower back. It is a great option for some patients, but not everyone is appropriate for the procedure. Finally, as I mentioned, all of these procedures, there are tons of different ways to do them, and some are more minimally invasive than others. As a minimally invasive surgeon myself, I'm very lucky in that the procedures I do can offer smaller incisions with less muscle disruption. And to me, that's the most important part, is that less muscle disruption, because that's what results in lower complication rates and a faster recovery. In some cases, in a lot of cases, traditional open surgery where we make a midline incision and we elevate the muscles off the spine still may be the best option. It's really patient specific, and matching the condition and the anatomy to the surgery is one of the most important processes. The recovery varies. Some people, and everyone really, should be walking the same day of surgery, whether you have a discectomy, a laminectomy, or a spine fusion. Some patients do have a little bit of a slower recovery and need a little bit more assistance. There's an entire other video on recovery after spine surgery, and it is indeed very dependent. It depends on the type of surgery, your overall health, and how committed you are to your postoperative care. But with the right team and with the appropriate indications, most people see dramatic improvement in their pain and mobility. So to recap, a laminectomy relieves the pressure from spinal stenosis by removing the bone as well as the ligament and other structures that have overgrown. A discectomy removes a portion of a herniated disc that can produce fragments that are pinching on a nerve. The fusion stabilizes segments that might have abnormal motion or are deformed or severely degenerated. And a disc replacement can be used to potentially remove a pain generator and also maintain motion at that specific level in the spine. There are other techniques, as I mentioned, that go within these categories that can allow for faster, minimally invasive approaches that are actually easier to recover from. So if you're facing spine surgery, I hope this gave you a little bit of clarity. Hit like if you found it helpful and let me know in the comments what questions you still have. And don't forget to subscribe. We cover spine health from every angle without the jargon.